I'm an internal medicine doctor.
And what brought you to Brighton Bush?
Well, I have been working for the Indian Health Service up in northern Minnesota for the Leech Lake Band of Ojibwe for the last 20 years. And I've really loved my job there. When I moved up there 20 years ago, I found this wonderful group of physicians there who were who were like-minded. They had a vision of healing, of taking care of the whole person, and a vision of caring for a community of people, not just individuals. And we became wonderful friends with my colleagues and friends with my patients, and it was a job where I could spend time with my patients, different from a lot of the stories that I feel like I've heard here, where I could, take time with my patients and know their families and take care of the grandmother and the kids, and be with patients at the time of their deaths, be with the family, which is a great privilege of our healing profession. And one family even adopted me into their family, and a whole ceremony adopted me in, and they took care of Lillian through many bouts of heart failure, and saw her almost every week. And she died, and I continued caring for her husband and for years, and he ultimately died too, and I was there at his funeral, and I know all his kids, and my children even know that family too, because I'll sometimes bring my kids in to see my patients, because they want to know who my kids are. But it's a wonderful thing, so I probably shouldn't be crying about it, but and just the other day I was going through my kids' books and said, well, can't we get rid of this book? They said, oh, we can't get rid of that book. Laura gave that to us, and Laura was one of my elders who I cared for 18 years till she died 2 years ago. And she'd give my kids presents, and I brought them to see her in the nursing home, and they didn't want to give up Laura's book. And I felt really supported, sort of like I think we have here at this, because I had these colleagues, these wonderful, incredible doctors I was working with, who just cared about their patients and wanted to care for people in the best way that they could. And it's really been wonderful, and I felt grateful that I had this haven, sort of a secret haven outside of the rest of medicine that I would hear about when I'd call my friends from medical school or residency, and they'd tell me about their jobs, or they're seeing so many patients and doing all these billing codes. And until just a few years ago, we didn't even have to do billing codes. We just could see the patients, and that was it. And you have to write a little note, but so it has been a wonderful 20 years, but things have changed. It's working for the federal government, so there's a lot of bureaucracy and dysfunction from the federal government, but we've always had, because we've had strong physicians, and at least a physician who could be a strong leader, they would help us have a voice in how we would practice, and that's changed. I think the administration, the higher-ups, found a physician who was a wonderful physician, and a good person, but a very, very weak administrator, and someone who wouldn't speak up for the patients or for the medical staff, and they put him in the position of being the medical staff director. And so we lost any kind of voice or anyone to advocate for us and for our patients and the relationship we wanted to have with our patients. And that's been for several years, but then the administration, I think, has consciously made a change about a year ago to force out the physicians who they didn't see as productive enough. So one of the physicians, another internal medicine doctor, who I actually recruited to come there because she was unhappy at her practice in California 17 years ago. I recruited her to come, and she's worked with the community for 17 years and seen, some of the most complicated patients with such histories of trauma, and she would spend so much time with them, and they forced her to leave by cutting her salary and telling her she was, I can't remember some word, that she wasn't, they didn't want her, and so she left because she didn't feel supported, and that, and then other people, they did the same too, and so we basically, they have a plan to find new, younger doctors, the poor doctors coming up after us, who they feel have been trained better. So they've been trained to see more patients. That's one of the questions they ask: how many patients can you see in a day at your previous practice? See more patients and work for less money, and work full-time, because several of us have been working part-time because that's the way we can find a little bit of balance in caring for these patients who've had so much trauma, both personally and historically, in their lives. And they want to move to this whole new model, and that we have no voice to change that now. And so I've been in a really hard place for this whole year. Slowly, one by one, as through the year, one provider after another has left until I'm the only doctor there now seeing adult patients. And one of the things that I think has helped the other doctors leave is they've known I was there to sort of take on those really hard patients, and I'm grateful that that's helped them leave a little bit easier. But now I'm there with some good nurse practitioners, but they need support and guidance. They can't do it all on their own, and I just feel, how can I leave now? Then there's no one there. But yet, how do I stay in the system and how it's changed? And every day, my patients, because so many people have left, not a day goes by, my patients say, "You're not leaving, are you? Please don't leave me." I love you, they say, and they embrace me after their visit. And they thank me for caring for their families. So it's a hard place to be in, and I know I just feel such gratitude to have had this 20 years, to be able to practice the way I have. And I know many people that I've heard their stories haven't even had that and been able to have the kind of relationship with patients that gives me such great joy in my life. So I guess that's why I came here, was to try to find an answer to this terrible bind that I find myself in, just really torn apart by it.
Based on what you just shared with me, what is some advice that you could give to the up-and-coming medical students and the young doctors that are coming in as replacements, for lack of a better word?
Well, I mean, I think I would hope that they could see outside the system they've been indoctrinated into, because I think the way the system works is you just are taught, this is how it is, this is your reality. You see 20 patients a day, you do it as quick as possible. You don't take time to know the patient's story and the trauma they've had, or those kind of things. I think by the time people are done, I don't know if they have a vision of another way to be. So I would hope that there's some way for up-and-coming young doctors to see a vision that this isn't right. this isn't the right way to practice, and I think, you know, the work that Pamela's been doing in this conference is to try to, maybe we can somehow share that vision with these young doctors, because, you know, we interviewed a new doctor to come to our practice, and I, you know, told her, well, there's this whole new thing on productivity. She said, oh, I don't worry about productive. I can see people really fast. You know, so I think people are just, they may not know there's another way to be. And somehow we need to let them know there is another way to be. Because even in my little haven that maybe was another way to be is gone for me, or it's changed.
So for the past 3 to 4 days that you've been here, is there anything that you can let us know that you can share that you've learned or gained?
Well, I feel that it's been very supportive and nurturing to hear all the stories of everyone here who, you know, have many different types of experiences, but also have had similar suffering. And that feeling of camaraderie to share that and to speak those things out loud has felt really helpful to me. And, you know, I know, and I already sort of knew coming into this, though it became clear early, that I have to let go of a lot of this grief and anger, because I can't really move forward to know what I need to do until I move through that grief and anger that I've been feeling for this past year. And I feel like the support of the group has helped me start moving through that and moving past that anger and grief. I hope that it has. I feel like it has here, but I'm sort of scared to go back out there to know what will it feel like when I get out there. Will it all come back in the same way, or will I really feel different? And I'm hoping that I'll feel different, and that will give me some clarity of where I need to move now, where I need to go now.
In closing, is there anything else that you would like to share?
I guess I just feel very grateful to have come on this weekend, and for the whole group, and for this work. And I hope we can continue to move this forward to help other people.
Thank you.